The urinary incontinence is the involuntary leakage of urine. So you're leaking urine when it's not in a convenient place and when you really don't want to. There are two main types of urinary incontinence. There's stress urinary incontinence, which isn't a great term, but really refers to when people cough or sneeze or move or jump or run or do any sort of exercise, they leak urine. And then there is urge urinary incontinence. That's when you feel the urgency to go, but you can't hold it, you can't defer it. So you leak urine before you get to the toilet. With female stress urinary incontinence, the main risk factor appears to be childbirth. Smoking and obesity can also cause stress urinary incontinence. In men, stress urinary incontinence usually occurs after prostate surgery. So following benign removal of prostate tissue, such as after homeomanipulation of the prostate for benign prostatic symptoms, or after radical prostatectomy for surgery for prostate cancer. We don't know what causes urge urinary incontinence, but certain risk factors include age, pelvic radiotherapy or pelvic surgery, or from neurological conditions. Women suffer from stress urinary incontinence more than men, and typically they will come on after childbirth. Urge urinary incontinence, interestingly, is more frequent in women in their 20s and 30s and 40s, but around the 4th to 5th decade, it then becomes much more prevalent in men. So urinary incontinence can come on temporarily with a urine infection or occasionally with a bladder stone. Uncommonly, it may occur if you can't actually fully empty the bladder, so-called urinary retention, when you have overflow incontinence, a bit like a bucket that's too full. Very uncommonly, urinary incontinence can occur with an abnormal connection between the bladder and the vagina, called a vesicovaginal fistula. This can occur after surgery or radiotherapy. Very rarely, urinary incontinence can occur due to a congenital condition you were born with, such as an abnormal tube that goes from the kidney straight out into the vagina rather than a bladder. That is called an ectopic ureter. The most common group for this are conditions that affect the nerves to the bladder. This can be from diabetes or pelvic surgery or neurological conditions such as multiple sclerosis, spinal cord injury, or Parkinson's disease. I see lots of patients with neurourological problems that can often be assessed and treated and significantly improving your quality of life, but also reducing the risks of urinary tract infections, dangerous orthopedic fractures, and falls.